And once we're live, Janelle, you're first up, and then bring Dr. Barbara on.
Okay, guess we're ready. Hello and good afternoon, everyone, and welcome to the Black Health Trust Weekly Program. My name is Janelle Maxey, and I'm your host for today. It is a beautiful day in Los Angeles, California, and I hope you all are doing well wherever you're at today. Today, our panel will be moderated by the distinguished Dr. Randall Maxey, Chief Medical Officer of Advanced Community Medical Care Corporation and co-founder of the Black Health Trust. He will introduce his wonderful co-moderator and guests today. What is our purpose, you ask? The mission of the Black Health Trust is to provide credible insights from our community health experts to best serve our communities of color with a coalition of leading and long-standing Black medical professionals across a diverse spectrum of disciplines to offer unvarnished opinions and insights into our physical and mental health during these challenging times. Before we begin, I would like to share a few housekeeping items and announcements for the program. Please be advised that this video conference is live and being recorded on different public platforms such as Facebook Live and YouTube. Your participation on this call is completely voluntary, and if you choose to stay on this call and prefer not to have your image and likeness displayed, there are visual and audio settings on your personal device that you can use to block your picture and mute your voice. All participants will be muted for our Zoom technician initially. We ask that you remain muted until the host or moderator asks you to contribute in order to minimize the distraction of background noise so that we can give 100% attention to our speakers. Check and make sure that your device is on mute, please, until called on to speak, and then once again, place your device back on mute when you are done speaking. As for the chat room, if you have any questions, you can enter them into the chat room, but please limit your questions to 2 questions per topic being addressed, and please do not use this forum to advertise or promote your products. Understand that there may not be sufficient time to get to all of the questions during the call, but we will definitely do our best. Be advised that this information communicated on this call is not deemed to be medical or legal advice, and you should always consult your medical or legal professional for advice pertaining to your particular situation and needs. Black Health Trust needs you to continue bringing our community outstanding programming, critical and timely information. www.blackhealthtrust.org needs your support. Visit the website to learn more about our programming and how to support, volunteer, and/or donate so that we can get this information out to as many people as possible. Visit our website, blackhealthtrust.org, to donate via credit card and PayPal, as well as with Cash App, using the handle $Black Health Trust. We are so grateful for the numerous health professionals that have donated their time to the Dynamic Sunday programs since the beginning of the pandemic. Our goal is to inform and help people of color become and stay healthy. Black Health Trust is developing the structure for a well-managed nonprofit organization, and our continued success depends on your contributions. Please consider a modest donation or more, as every dollar counts. Visit our website, blackhealthtrust.org, to donate via credit card with PayPal as well as Cash App. I want to thank the Black Health Trust Steering Committee, the Executive Board, the Virtual Administrative Assistant, our production and Zoom technician, and all of the people behind the scenes for their time and efforts to make this program possible. We want to give a big welcome to all of our distinguished physicians and special guests, and we thank you for sharing your valuable time, information, and educated insights with us today. Your participation and support help to empower our communities of color, and this is critical to our present and future well-being as people. Knowledge is power. Welcome again, everyone, to the Black Health Trust Weekly Program. This is our community, and this is our time to improve our health. Grab your coffee or tea and get comfortable and lean in. Dr. Randall Maxey, please do us the honor of moderating today's program.
Thank you so much, Janelle. We appreciate your giving your time. And I appreciate my associate, Dr. Barbara Nabert Stevens, who will be introduced very shortly. Looking at the news, we have a multiplicity of crises going on now. We know that COVID is bothering our country, our world, and the numbers are increasing. We know that the effects on communities of color are in some cases 3 or 4 times the death rate in other populations. We're concerned. There's also the concern about food insecurity, that more than 20% of our populations don't know where they're going to eat today, let alone tomorrow. We also have the release of the new vaccine, and there are those professionals that are heartily for it. There are those professionals that are against it, and then there are those that don't know yet. We've set a process that we can give what we call credible advice. But just looking at these statistics, the total cases of COVID in December the 6th of 2020, there were 14,462,527 cases in the United States, with over 93,000 new cases occurring. And the number of cases in the previous 7 days, the percentage out of 100,000 patients was 57.6. Now that caseload per 7 days is 63.9 per 100,000. And the deaths are 294,535 with over 3,013 new deaths. So we have a lot of concerns, and we know the information is coming fast, furious, a lot of it credible, some of it not credible at all, given all the politics that affect our country. As of today, the 13th, we know that that number is over 15 million cases, 14 million rather, cases in the United States, and that is something of concern. We have a couple of special guests, and I want to introduce them very quickly at the front end. One is the president of the National Medical Association, Dr. Leon McDougall. He represents the organization that most of the physicians of color in the United States belong to, and they've created a vaccine task force. I'd like to recognize and honor Dr. Leon McDougall to speak for a few moments before we start the rest of our planned program. Dr. McDougall.
Thank you very much, Dr. Maxey. I will be brief. I won't be able to stay much longer, but you are doing important work. As you know, the National Medical Association, through its House of Delegates, passed a resolution to establish a COVID-19 task force on vaccines and therapeutics. I was assigned to appoint that expert panel, and your partner, Dr. Nabert Stevens, helped to identify experts across the country, experts in infectious disease, pediatric infectious disease, members of the Advisory Committee on Immunization Practices, State Board Review for COVID-19, and the president of the National Pharmaceutical Association, the Black pharmacists. So we've come together and we've been meeting with Pfizer, Moderna, and AstraZeneca. In fact, we have an upcoming meeting with them this Friday, both with Moderna and Pfizer. And as we spoke to earlier, you've invited me to speak next week in a longer format to kind of share our findings. And the discussions thus far have been very positive. I think it's going to be more of asking and finding out information concerning one, are there any precautions that should be observed for people with sickle cell or sickle cell trait? Are there any allergy differences or outcomes differences when comparing the Black cohort with other cohorts? And also, whether one has a specific blood type. Apparently, if one has A blood type and some others, once contracting COVID-19, there have been worse outcomes. And then lastly, amongst some of the other questions about fertility, are there any fertility concerns with the vaccination? So I hope to speak to you next week in this group concerning our discussion. We want to be advisory in regards to the vaccine from both Pfizer and Moderna. So look forward to joining you next week in this important work. I think that's less than 2 minutes.
Well, thank you so much, Dr. McDougall. And the NMA is doing heroes work, and we depend upon our organization representing the interests of physicians of color in the communities that we serve. So we certainly appreciate you and all that work with you, and all of you physicians on the line, pay your dues to the NMA so we can keep doing this work. Thank you so much. Simon, can you show that brief video, and then I want to recognize Dr. Ivan Walks and then turn it over to Dr. Nabret.
Dear Black America, we love you. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be a core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available. However, for this to be successful, they must do more to earn your trust now and in the future. We are on the front lines in care delivery and in key decision-making roles, from the lab to the clinic to the virtual boardroom. We urge you to hold us accountable. Please wear your masks, continue social distancing, hand washing, and avoiding indoor events until vaccines are widely available. With the holidays around the corner, we want nothing more than to break bread with our loved ones. But tradition cannot stand in the way of our health. We also ask you to join us in participating in clinical trials and taking a vaccine once it's proven safe and effective. We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival. Please visit blackcoalitionagainstcovid.org/loveletter to learn more about the work we are doing to keep our beloved community safe. We will keep you in our hearts while we work to create a world that is healthier and more just than the one we know today. Love, America's Black doctors and nurses.
Thank you so much, Simon. Before Dr. Naybert Stevens comes on, I'd like to briefly recognize Dr. Ivan Walks, a previous medical director and director of public health for the city of Washington, D.C. Dr. Walks.
Good afternoon, Dr. Maxey. It's an honor to be with you, and always a pleasure, particularly to be with you, Dr. Maxey, my dear friend and brother of many, many years. Dr. Maxey, I shared with you earlier and just wanted to raise a concern that I have with respect to the work that so many brilliant and dedicated folks are doing around the vaccine. And it's this concern. We health people, we promote the flu vaccine every year. It's only about 40 to 60% effective, but we think that's effective enough to ask people to get your flu shot every year, and we do that. What we're hearing now with the COVID-19 vaccine is that 95% effective. Moderna, Pfizer, 95%. Everybody's excited about that. People are talking about that, and that is a big deal. But there won't be enough of that, at least that's been purchased now for everyone. And my concern is by the time we get around to our community, the vaccine that we have, at least preliminarily, looks like it may be about 70% effective. Now that's still great. However, the concern is if the vaccines are safe and effective and the 95% vaccines are not available by the time you get around to the general public, are we setting ourselves up? Are we making a big deal about 95%? And then people later are going to say, wait a minute, in my neighborhood, you're giving me the 70%. Is this, and then all of the stories come out about all the ways that people have been discriminated against in our communities. And we already have a challenge with getting folks that look like us to take the vaccine or to say they're willing to take the vaccine, no matter who says the vaccine is safe and effective. So my concern is, let's be very clear about the fact that not everyone may get the 95% vaccine for many reasons. We don't have minus 70 degrees Celsius freezers. We don't have a lot of refrigeration. We don't have the infrastructure equally across the country. Many communities will have to look for a vaccine that may be easier to store and easier to dispense. So we need to not get everybody thinking that the only good vaccine is a 95% vaccine, unless that's true. And we don't know that yet. So let's let people begin to have this conversation about when the vaccine comes to you, the National Medical Association, the Black Health Trust, we are going to be the ones who are going to be looking out and making sure that people are getting good advice. But we can't be put behind the 8 ball by folks saying, oh boy, 95% is what you should be looking for. Not the way for us to start having the vaccine conversation, because it's not the only vaccine that's going to be available. And we don't know yet whether the 70% vaccine or the other vaccines that are coming down, up to 14 different vaccines are in trial phases at this point. So I just want to put that out there so we can be ready that pushback that can be avoided if we start having a conversation now. Thank you, Dr. Maxey.
Thank you so much, Doctor. Appreciate it. And we're going to ask you to work with our medical advisory for the Black Health Trust to help us translate from the National Medical Association the findings of their vaccine task force and with other practitioners on our panel and come up with what we can, the good, the bad, and the ugly, and find out, are we going to recommend vaccines, and if so, when? And I'd like to introduce thank you, Doctor.
Yes,
Appreciate you. Dr. Naybert Stevens, who's been a colleague of mine for more than a few years. She not only is an MD, a pediatrician, former chair of the pediatric program at Meharry Medical College. She's also holds a Master of Health and MBA and every other degree you can think of. She went to school in Boston at Tufts and at Harvard, and also at University of Tennessee, and did her internship where they practice real medicine in New York City. I'd like to introduce the remainder of our program, which is on mental health, Dr. Naybert Stevens.
Good afternoon, everyone, and thank you, Dr. Maxey. You know, we always have a very meaningful program, in my opinion. But I think Dr. Walks has started us off at a point that I hope everyone is taking in, because what he is identifying is one of several issues that don't get the prime time coverage on TV, but which are critical in our for our lives and in our lives. Even if it and maybe this is just me, and then I'm going to do what I'm supposed to be doing, which is introducing everybody, but it really annoys me that so many people on TV, and not just the newscasters, but all the TV docs and everything else, are touting the effectiveness of these vaccines without defining what effective is. And if you don't know what effective is, how can you even begin to make any kind of informed decision about what you want to do? And I don't know if it's intentional. I want to be positive and assume that it is not being done for any bad reason. It's just an assumption that everybody knows what effective is. But in point of fact, effective has a wide range of meanings, and it needs to be specified what it is for each and every one of these vaccines, just as a starting point. Then we can even start talking about risk and everything else. But just what does the vaccine do? That would be helpful information. And I suspect we will be having intense conversations going forward as our different advocacy bodies deliberate the information that is being released. And we hear from the NMA task force, we hear from the BHT task force, and we as a community have open conversation about what's going on in this country. But now moving on to what my real assignment is. It is my pleasure to actually tell you a little bit more about Dr. Randall Maxey. One thing about Dr. Randall Maxey, he has so much going on that it makes it easy to do an introduction for him each week, because there's different aspects of his life that I can shine a spotlight on. And I don't think I have ever, I've never said, and I don't think I've heard him mention the fact that his practice of medicine, especially in his area of expertise, which is around disease of the kidney and cardiovascular impact and cardiovascular pharmacology and drugs, has not only been practiced in this country, but he's actually recognized not only in the continental United States, the territories of the United States, but internationally. And I think it's important that we recognize his accomplishments and his achievements so that we can value his input and more especially his vision. He also, I don't want to neglect to say, is a former president of National Medical Association. And so there is the close relationship and synergy that exists between NMA and Black Health Trust. Now, he asked me to tell you a little bit about me. One thing I do want to share or correct is I wasn't the chair of the Department of Pediatrics at Meharry, but I was the director of pediatric education. So thank you for that promotion, but I didn't quite get there. I am a Southerner, surprise, surprise, by my accent. I'm a proud native of Memphis, Tennessee, and was fortunate, and I'm bringing this up because I think it's important for our younger audience to appreciate where we are and why we are where we are. I actually was able to accomplish or have the opportunity to participate in a varied educational experience as a result of the assassination of President Kennedy. When President Johnson was inaugurated as president, and as you know, he was a Dixiecrat, his fellow Dixiecrat said, you know, you're giving us all of this grief about segregation and here in the South, what are you doing about the segregation that exists in the North? And so as a result of these conversations, he formed had a group formed called the Independent School Talent Search Program, which evolved into a still existing organization known as A Better Chance. And A Better Chance toured the southern states and visited the segregated schools there in the South and identified talented students. And we were brought to prep schools in the Northeast. And then once we were in the prep schools, it was a stepping stone into whatever college we wanted to go to. And I'm bringing this up because I really think it's important for us to know our history, and more importantly, understand our history so that we can understand what's going on now. After going to Harvard and Tufts Medical School and having the opportunity to specialize in pediatrics, I have had a very fortunate career where I have been able to participate in various facets of the medical experience. And I would have to say that of everything that I've done, I am most proud of and think the most important thing is participating in Black Health Trust, because I think it is critical that we get credible information into our communities so that we can make good decisions and improve our overall health. So with that, I will move on to the next part of our program, which is going to be, which was developed per our request to by one of the Black Health Trust members, Dr. Michelle Clark. Now, Dr. Michelle Clark is as interesting a person as Dr. Maxey, and I am truly honored to be working with her because she has done a lot of the groundbreaking work that has needed to be accomplished in bringing the discipline of psychiatry into a culturally appropriate milieu. She is a graduate of Hunter in New York, and she went to Columbia Medical School. I don't know where Dr. Clark is from, but she made her way to the West Coast and has had quite the career on the West Coast. And I'd like to highlight the fact that she served on the faculty of Charles R. Drew University School of Medicine and Science, and was the founding director of the Psychiatry Consultation and Liaison Service, and subsequently joined the faculty of University of California, San Francisco. She was recruited there because of her expertise in cross-cultural psychiatry. So without further ado, I'd like to turn the program over to Dr. Clark, who has put together an outstanding lineup of speakers to address issues of psychiatry in our community. Dr. Clark.
Thank you very much, Dr. Nabert, for that very generous introduction. Thank all the speakers this morning for the timeliness, because we are still on time and I love it. I'm honored to have been asked to curate this program by Drs. Maxey and Nabert Stevens. Today's panel was formulated for the Black Health Trust program due to our anticipation of the mental health fallout from the unprecedented combination of COVID-19, viral pandemic, and the recently stoked racism pandemic that followed the publicly televised murder of George Floyd. I do have slides. Can you put the slides on for me now? Well, I know you can, will you? Thank you. And let's just go immediately to slide number 2. In the Western tradition of respect, I will ask the permission of the community to speak and of the elders of the community. And since I know Dr. Maxey is not only my former preceptor and mentor, but he's also my elder, I'm assuming his permission today. I also want to give gratitude to my psychiatric mentors who are responsible for great influence in education and support during my education. Slide 3, please. And it's interesting to me, the color's not coming through. So the purpose of this is to improve the understanding of and capacity for mental health by sharing our knowledge and wisdom. Our goal is to demystify mental health issues and diminish stigma toward improving mental wellness and willingness to access care. What I want to do is distinguish the impact of white supremacist racism from mental illness so that we're clear. Next slide. Okay. So I prefer the definition that was coined by Dr. Chester Pierce, who's a professor of psychiatry and also education at Harvard University. He defined it as a public mental health disorder, and I think it's the primary social determinant impacting Blacks' mental health. Racism is a public mental health disorder based upon the false belief, which is a delusion, that one group of people is superior to another based upon skin color, in spite of overwhelming evidence disclaiming that. In the mode of all public health problems, it will require much time, money, and many resources to eliminate. And I can compare that to COVID. Next slide, please. Thank you. So the impact of the unique manner and method of slavery defined and analyzed by Orlando Patterson, who's also a professor at Harvard University in the School of Social Work. It has created a chronically hostile environment that leads to multi-generational trauma, evidenced by archetypal reactions occurring within us Blacks. It's almost like the ducklings in the shadow of the wolf. During the present, or the hawk, during the present, in response to daily micro and macro aggressions that trigger our emotions. Next slide, please. Okay, the condition is described by Dr. Patricia Newton and made popular by Dr. Joy DeGruy. It's referred to as post-traumatic slavery syndrome. And it occurs when the stress of the racist environment triggers these archetypal trauma-related anxiety, anger, chronic dysphoria, and it features signs and symptoms such as hypervigilance, increased startle, emotional numbing and withdrawal, avoidance of the stimuli, and intrusive, recurrent, involuntary distressing memories. Next slide, please. So post-traumatic slavery syndrome is one of the many outcomes of white supremacist racism and a primary social determinant of Blacks' mental health. It's a natural reaction to a unique and unnatural conditions and differs from the mental illness major depression. Our presenters today will address the mental illness of depression with attention to the impact of the illness during various stages of our lifespan. I want to emphasize, it's very important, these mental conditions are treatable and they can be survived. Without any further comment from me, I'm going to introduce our first panelist, Dr. Maja Jackson Treash, who is an MD and MSHS professor of psychiatry at the UCSF School of Medicine and author of the book, Beating Depression, The Journey to Hope. Her research has included the areas of depression and health-related quality of life in African Americans and other ethnic minorities in the United States. Thank you for joining us, Dr. Jackson.
Okay, hello. Can everyone hear me? Thanks, Michelle, for that really nice introduction. And I want to just express my gratitude to everyone on the call today, and to you especially, Dr. Maxey, for establishing this trust. This is a wonderful service. And so what I'll do is talk about clinical depression. I think that people often get a little bit confused about what's depression, and at what point should I go see someone. So I'll talk a little bit about that today. COVID, as we all know, has put us in a situation that's unprecedented, so that people are both, especially in our community, are parts of populations that are more exposed because of the kind of work that they do. In addition to that, they've had the added stress of trying to work with children at home, with homeschooling, and all of that is in a setting of exacerbation of the political and social climate, with tremendous focus on racism and exacerbation with the issues going on around the police. So it's a time of stress that is really unprecedented because of the circumstances and because of an infectious disease and a pandemic that really limits our mobility. So I think what happens with a lot of people, and the people that I see at UCSF, is trying to determine when it's, well, yes, I'm depressed and I'm stressed, but who wouldn't be? And then deciding whether that's something that needs to be addressed by treatment. So I'll talk a little bit about the differences between clinical depression and depression that's less severe, and talk a little bit about some of the strategies that people can use when they're having feelings of depression and anxiety and loneliness and things like that, and when they should try to go see someone. So clinical depression is, the hallmark of it is feeling blue and feeling down, having a depressed mood most of the day, nearly every day. It's marked by diminished interest in pleasurable activities. There's either significant change in weight. So there's really a physical component to it. So people will find that they're losing weight without intending to, or gaining weight without intending to. The remarkable thing is that it's something that someone's not intending. One of the most common things that troubles people is that there's slowing down of thinking and ability to concentrate. So it interferes with people's ability to do the work that they've usually been doing. So it's usually a significant change in terms of their functioning, either their way to work or their ability to deal with family issues. There is often feelings of fatigue and loss of energy. Again, these symptoms are nearly every day. It's not something that comes on and you have a few days where you're feeling bad, and then then you're feeling a little bit better on some days. This generally is what I would call an unremitting sort of fall into severe feelings of depression. Not often people will complain of not being able to get out of bed. They'll force themselves out of bed, but they'll feel like they don't want to get out of bed. There's a disruption in sleep behavior and a change in sleep behavior. So often what will happen is people either are having early morning awakening or they're sleeping more. So there's a wide gamut of symptoms, but they're usually a significant change in terms of the usual pattern. They're often, and I know we have someone on the panel who's going to talk a little bit about thoughts of harming oneself, but people will say, I'm all of a sudden starting to have recurrent thoughts about death, and I can't keep myself from thinking about that. So that's something that's really important to get assessed as well. So a couple of things that, I would say these are the basic symptoms, and I can go back over those in terms of the questions and questions and answers if you'd like to do that. But it's sort of the point at which you should get help. Often what will happen, and I did a lot of research in Los Angeles with the Black community in terms of looking at depression, and I could find there were certain myths about depression. And one of the myths was that it's a spiritual crisis only, and that someone should just be able to deal with it, and what we're finding, we did a lot of coalition with spiritual leaders across the spectrum of the different religions to help people understand that clinical depression is really a medical illness. It's prayer is very helpful, and having spiritual counseling is very helpful, but actually it's a treatable medical illness, and it's something that requires treatment. Now, the kinds of treatment vary. There can be mild, moderate to severe depression. And so in mild depression, often psychotherapy alone, that's going in and talking with someone about the issues. There are different kinds of psychotherapies that are available. Cognitive psychotherapy is one of those, and we can talk a little bit more about that in the Q&A. But that's been very helpful and very successful to people in terms of recovering. Occasionally, and at sometimes when it's moderate to severe depression, people will need to have medications. And what I wanted to reinforce for people is that the medications really are highly successful, and that people really can recover from this. This is it can become a chronic illness. What we hope is that people get treatment early so that it doesn't become a chronic illness, but it's highly treatable, very effective, and people will find that they will have a really good return to their regular kind of functioning after that. So that's the good news about it. It's not a failing on someone's part that will often, people will come in and say, well, I'm a failure that I can't overcome this. It's really not that. It really is a medical illness, just like other medical illness that has good treatments available. Now, one of the things that has happened with COVID that really concerns me and it concerns a lot of us is that the resources for people really are becoming more and more limited in terms of getting mental health support. The good news is that there are a lot of systems now who have telehealth available for people. So that's being able to go in and get an assessment, meaning that someone can do a credible and effective assessment over the telephone, and also can do treatment over the telephone. So there are many, many community clinics, county clinics, and other areas I know, like Kaiser, UCSF, a lot of those other institutions are offering telehealth. And during COVID, insurance is also paying for telehealth. So one of the things that would be important to do if someone who's listening to me is feeling like they're becoming significantly depressed and they would like an assessment to see what the next step would be, is to look at your resources in your community and ask for telehealth. Now, telehealth can be delivered either through the computer or through your telephone. What we found is that it's really effective either way, which is nice. I'm going to talk a little bit about some of the things that do help when the depression or you're having the feelings that are mild or moderate. Some of the self-help things that people can do. Michelle had talked about my book, and I go into that into a little bit more detail. But to participate in regular physical activity, now that can be challenging in COVID because there's so many things that are closed. But if you are able to do, one of the people that I work with actually goes on her computer and does some of the exercise. They have Zumba and some of the other things that are available on computer now or on their phone so that you can keep your physical activity up. That we know is protective in many ways. Trying to eat as healthy as you can, we know that that's protective and also helps with depression. One of the things we also know is that it's good to avoid tobacco and alcohol. I think many people are saying that, well, what can I do? Drinking, helps, or other substances help. But actually what happens is that it complicates the issue and it does make the depression more severe. We do know that. And it has a negative impact on the recovery. So it's really important to avoid that and minimize that if possible. One of the other things that we found is that it's important to limit screen time. A lot of people have talked about listening to the news, and as we know, it's been escalating in terms of people's feelings around trauma, around racial trauma. I know I myself have felt that when I've turned on the news and looked at that, and the way we're dealing with our politics right now, it often can make people feel much worse. And so I'm not telling you not to be informed, but you may want to limit how you do that and be very careful about who you listen to and what you pay attention to. One of the also of the most important things is for people to engage in other self-care, really the sort of reminding yourself or discovering what helps you. For some people that can be meditating or doing yoga, and all of that. Now there are resources on the internet that can help you with that. But engaging in self-care, if that means you could want to design your own little spa treatment for yourself at home and, get some quiet time. I know that one of our staff was telling me that this has gotten more challenging because the kids are at home and, you're trying to do homeschooling, which is can be very challenging. I was also involved in Katrina, and I remember my younger son was 8 and we had to do homeschooling, and I know that that's an incredible challenge. We also have people in our community who are taking care of elders and ill family members, besides dealing with family members who've had COVID. And it's really important. It's at that point that people often say, well, no, I don't have time to take care of myself. But it's really a lot like when you're flying and they tell you to put your mask on first before you help someone else. Even if you can get a few minutes to help yourself, to sit and listen to music or something that calms you and makes you feel better. Some of the patients that I've worked with have joined book groups, over the computer. So there are a lot of things that you can kind of do to research and help yourself to find resources that can help you get through that. And the other thing is, it sounds contradictory to say that, but just trying to get yourself to relax and finding out the kinds of things that relax you. If that's even having a cup of tea or talking with a friend, that would be very good. So I think that's a lot of information, but I think I'll end now and just sort of open it up for questions.
Thank you so much. Dr. Clark, you want to lead some questions and also look at the chat box? I think you're muted.
You're on mute. I know I went through pretty quickly. I tend to talk a lot, and so I was trying to not talk over. That's because I know we have a large.
You did a great job. Thank you. I love this panel is being really on time and not creating speaker abuse by encroaching others' time. Do we have questions in the chat box? I don't know who to direct it to because Michelle's not on today. Hi, Janelle.
Hi. I don't see any questions in the chat box related to what
related to depression. Okay.
Let me pose a question if I can, Dr. Clark. First of all, thank you, Professor. I appreciate that. And I'm not going to curry favor to tell you that my daughter's a third-year student up there where you ought to look out for her. But in the meantime, in my practice, every day I take care of a lot of professionals, especially pastors, and even in some cases, physicians. The minute I suggest that it would be good that they had someone that they could talk to, that they could have a way to talk through some of their issues, the first word out of even the professional's mouth is, I'm not crazy, doc. How do we approach that problem? That seeing a psychiatric person or a psychologist is not synonymous with a negative label. How do we approach that?
You're on.
You're muted.
I'm muted?
No. Liza.
Dr. Jackson, unmute. Dr. Jackson is still muted.
Now, thank you. The program had muted me. Yeah, there still is a lot of stigma about going to a mental health professional. And what I've found is just, telling people, some of it has helped by getting to know people. And sometimes you can say, well, this is someone who I know, if you can say you know them personally. and do a personal referral, which I know Michelle and I've had to do for many people, so that they feel more comfortable with that. But the other thing that has happened is that there are a lot of primary care doctors who feel very comfortable with doing an initial assessment of those issues. And sometimes the way I've handled it is saying, well, would you see a primary care doc to just talk with them a little bit about it to make sure we don't have anything that's medical that's going on with you. And then, you know, once they build a relationship with the primary care doctor, who then has relationships with some mental health people, they can accept that referral. But it really does have a lot to do. There's still an incredible amount of stigma. There are ministers and who are very much advocates of you know, mental health treatment, and they're becoming more active in terms of working with their organizations around accepting that. And as you know, there's many pastors who've now started getting pastoral counseling training. And often what will happen is people will be willing to go see a pastoral you know, counselor. And then that can be a segue into seeing you know, a psychiatrist or a psychologist, social worker, psychiatric social worker. Where it's a little bit harder is when it's very severe depression. Usually primary care doctors will be willing to start medication, but then will want to refer them to a psychiatrist who's a specialist in those medications. And then we try to work on a one-on-one basis, but it is a problem. But it's getting better. I mean, I've been practicing a long time now, and I've noticed that it's gotten a little bit better and that the information is getting out. I think fora like this help.
I'd like to ask you to go a little further on the screen time in the context of what appears to me to be overutilization, well, not overutilization, but the impact of the utilization of social media, and how does that contribute to isolation and or depression because of bad news overload, if you will?
Yeah, there really is. There's a lot of trauma with having to listen to unfiltered, you know, news and incidents and having it go over and over and over again. And so what we've recommended is people really be very careful and judicious about who they listen to and how long they listen to it, and that they actually really turn off the television or, you know, the computer or whatever, the streaming or whatever. Also with social media, we're now learning that social media presents a very distorted view of life. And so that's been very, very hard for people as well. So mostly what we've been recommending, and I've been recommending, is people really limit their programs and limit the amount of screen time that they have during the week, and really carefully look at what social media they look at and listen to. So
We have a couple questions in the chat box.
Okay.
Are there problems getting off of psychotropic medications?
no, one of the things that's really helpful and hopeful about depression is it's not a medication that once you get on it, you have to be on it for the rest of your life. So there are some medications that have some mild to moderate side effects when people are stopping the medication, but those generally are managed very well. So it's not something that you say, oh, I get on these meds and then I have a hard time getting off. There were some, you may have been referring to some news reports but some of those I've gotten questions about that, but generally it's very, very, it's not traumatic to come off psychotropic meds, and most people don't have any problem. They're tapered off. It's not something that people just stop right away. When you start medications, they're usually tapered up to the point at which you get a response, and then they're tapered down and stopped. That's the usual progression. And the medications also are tailored to the symptoms that the person has as they present to the psychiatrist. And one of the things about psychiatric medications is sometimes you have to look at how they interact with other medications you may be on, and that's what psychiatrists are experts on, which is why it's very helpful to see a psychiatrist, you know, around the psychiatric meds.
Thank you for that.
I have a quick question before, as we transition. What is the difference for our lay audience? And we may have as many as 7,000 to 10,000 people online. Just for the record, what is the difference in a psychologist and a psychiatrist?
Okay, a psychologist well, I can start out with a psychiatrist. A psychiatrist is a medical doctor, someone who's been to medical school and has had an internship and a residency in psychiatry. And so they're physicians. And a psychologist is a person who's had training in psychology and has a PhD. And there are different kinds of psychologists as well. Some are research psychologists, some are clinical psychologists. And so the difference is the psychiatrist is a physician.
Well, thank you so much and appreciate your presentation. Hope you can stay around and answer some questions. Dr. Clark?
Okay.
Can you unmute Dr. Clark?
Thank you, sir. Okay, and thank you very much, Dr. Jackson-Treece. I'm moving on to the next presenter, who is Dr. Napoleon Higgins. I've had the pleasure of witnessing Dr. Higgins' outstanding career and his rise from his residency in academia and in Guild medicine. And it is really my true pleasure to introduce him. He's a child and adolescent psychiatrist who's been in private practice for 17 years in the Houston area. He's a past president of both the Black Psychiatrists of America and the American Psychiatric Association Caucus of Black Psychiatrists. He is currently the president of the Black Psychiatrists of the Greater Houston area. Dr. Higgins, thank you for joining us.
Thank you, Dr. Clark and Dr. Maxey, for having me today. I want to give a special thanks to Dr. Clark. I call her my psych auntie, and all the love that she's given me. She's definitely family with me and my family. So it's great to be here today. If I could have my slides up, please. And it's been such an interesting conversation to just witness and to listen to. And it's great to see the Brain Trust here for the work that they do and how important this information is to get out. I've seemed to lost my graphics here, but I'll assume I can get through it without it there. So we're going to talk about today children, adolescents, and families when it comes to navigating what I'm calling this third wave. When I say the third wave, I'm referring to the viral counts that we've seen within and violent death counts that are going on inside the U.S. And that many of us have now, when we've been talking about this, it was one thing to talk about COVID-19 in March. And I remember having a conversation with a group of friends like, hey, we need to do something about this COVID-19 like right now, because obviously this is something that needs to be discussed right now. Well, as you can see, this has gone on from right now to been now, and now it's post now, and then it's still just kind of riding on. So our, one of the presentations have changed, but also where our mind state has changed, and the impact is ongoing that we're having right now. So we're looking at the issue of the problem of social distancing and the chronic nature of it at this point. It was one thing where we said, okay, well, spring break, we won't be able to go out of town, but we'll be back at it by latest towards the end of the year. We'll be back able to travel, and we'll be able to see the family. So we're going to keep a distance from now. This is going to go on for a few weeks, and we'll be back at it. Well, here we are, summer, fall. Thanksgiving was different. Now we're looking at Christmas, and we're looking at these spreading events that are, we're having spread on top of spread while we're waiting on vaccines and things of that sort to come out. But you're looking at this chronic stress also we often forget about our children, where with our kids are now being stressed to the point where the schooling and the distance and the virtual learning and the fear of getting ill, the fear of going to school, becoming ill, bringing back to your family and possibly killing someone, All of these things are riding on these kids, and too often we hear adults talk, but the fact is that kids are impacted by these issues. These issues are, they talk about them, they discuss them. If you ask them, they'll discuss it with you, but they're not the talking heads. They don't make the presentations like we do, but we often forget about what is this doing to the kids. And also when we're looking especially specifically within Black families and kids going to school, many Black families live in multi-generational homes where essentially, you know, grandma, mama, cousins, auntie, all of these people may live in the home, especially when you look at some issues with lower socioeconomic factors. You're in a small house with a bunch of people of multiple generations doing different things. Some having to go to work because we're more likely to be in those jobs that are essential workers. Some are having to go to school, and all of us are coming into the house together. Realizing that we as Black people don't discriminate or we don't differentiate ourselves typically among socioeconomic lines, especially when it comes to church and school and where we go and where we hang out. So you're more likely to have a mixing of sorts of multiple different people and more likely to increase the spread. And also we as a people are more likely to, when they're stressed, we're more likely to come together, to put our arms around each other, to love on one another, to go to church, to express all the, to physically touch and to gather is something that we do that that's been taken away from, and now that has become long. Understanding that man cannot live alone. In that, when I say that, I'm referring to that we all are connected as a vine of grapes along stem here. So when you cut one set of the grapes off, the other grapes from the vine, that we all start to wither because that long chronic stress is now starting to get to us. Now, I know a lot of people who are now saying that, oh, I've adjusted and I'm doing fine and I'm doing great and yada, yada, yada. But most of us will say that we all have lost something, and the losses are now building up. And when I say that, I'm referring to, I can't go and see Michelle Clark and give her a big old hug. I'm sure I would have been out to Oakland at least once or twice in the past year, and we haven't had our normal. I can't see you all at NMA. I can't go to the church. And honestly, I missed my sister for Thanksgiving, and chances are I won't even see her for Christmas. And this is a complete disruption in the normal structure. But when you look at the kids, also, this is a disruption for them as well, and we have to remember them inside the home. So we have the need for communion, but at the same time, we have the ability to stay connected. It is great to be on the phone, to be on the calls, to do the virtual type work. Also, I've virtual birthday parties, and I've seen virtual. I've seen some of my peers have virtual happy hours. I tend not to attend those myself, but they all these things that can be virtual to make sure that we use the technology that we have so that we can improve our chances of our social connection throughout this pandemic. Next slide. So we're having a lot of stress in the home, all right? So the kids are at home, and the kids, and depending upon where you are in the country, some people are sending their kids to school, and some schools are closed at this point. And it seems to go back and forth, and this can be a big disruption with having that. And then so often, with the kids at home, and then also the kids being stressed mentally, the family, the parents not having the skill set to deal with that, all right? Because I know for myself, my daughter, she's a senior in high school, taking an advanced calculus class, computer science, a few other things. When I did computer science, we were doing DOS, like DOS. I don't know how many people remember that. I have no clue how to do JavaScript. I have no clue how to help her with that. I do not remember saying tan, and all those differential equations and calculus. I don't know any of that. So a lot, and I'm highly educated, but at least I have the resources. When you're looking at many Black families and homes, they may not even have those resources to be able to do that. And then also, I know we've seen in the Houston area where we've seen a doubling of the amount of kids who are actually failing at least one class. Double. It has now doubled. It used to be around, 15, 20% failing at least one class. Now we're seeing some numbers in the Houston area that are over 40% of kids are failing at least one class where they're not getting that, where they're not acquiring the knowledge. And then the scariest thing that we've seen is that when we went from the spring, we lost a lot of kids in the spring, you know, and the thought was that a lot of kids would, you know, show back up in the fall because obviously the pandemic would be done. Well, some kids have not been heard from, and some families have not been heard from in the educational system since March. All right. And then school started, they didn't show up there. And then what's even scarier now is that you're having kids dropping out of school who started in September, who are now in November and December are unaccounted for. You can't find the family, you don't know where they're at. And that is coming in with the issue of poverty. Some of the kids, you know, poverty impacting you on top of the COVID virus, on top of racism, where essentially those systems in place have kept you down. And now that a big issue has happened, now you're not able to recover, and you lack the resources to do so. So, you know, inside the home, also parental trouble is going on. You're having a lot of issues going on inside the house, and too often we forget about the kid is inside the house. What is happening to mom, what is happening to dad, whatever's happening to Annie, whatever's happening to grandma is also happening to the children in the home. The problem with the child is that, especially the younger they are, the less they are able to do anything about it. So as adults are struggling, or troubles are going on, or financial issues are going on, arguments are happening, the child is not able to actually contribute for the most part. They're not able to get people to do one thing or another. And they so often are hearing these things, or having to go to their rooms or find a place to go to try to calm themselves down while the adults are having the struggles. So a lot of things are not being seen inside the home, especially when you look at children and them not going to school. If there's a problem in the home, so often a professional at the school is able to see that something's going on and make an intervention. Without that professional being able to see, now you're having a problem being able to make the intervention. And with everyone being home, we have no force to address problems, and parents are not able to get respite at work, but also understand that children are not able to get respite at school. For many kids, the only normalcy that they have is the 8 hours they have at school. All right. It's untold stories, or many of us who are mental health professionals, you know the stories of what seems to happen when these kids are at home and we're not able to get to the school for basically sometimes it's the safe house. Trauma inside the home is often witnessed. Some kids are being left at home with adults who are not the best of people and could do traumatic things. Unresolved secrets and issues because of the powder keg of everybody being inside the home. Then, of course, witnessing and seeing domestic violence. And we've seen the number of shootings go up all across the country, both with partners and spouses actually shooting and killing each other with this stress that is going on right now. Next slide. So families are having the work stress. So far as many of our families are essential job workers. Now, of course, we are, as physicians, are essential, but I would say that I know for me, I'm lucky enough, I'm a psychiatrist, I do outpatient treatment, outpatient practice 95% of the time. So I'm able to see just about everyone over the camera. I have not seen a patient in my office since March. The last one I tried to see was someone who was in an emergency, came in, went over the rules, and he refused to put on his mask, even though he had been out hanging out and partying and doing everything else that he wanted to do during the COVID season here. So many of us are in these essential jobs where we can't afford to stop working, where, especially with many being CEOs, they normally can stay at home, but then you have the worker bees. I remember having a nurse friend of mine who stated that her, as an administrative nurse, they said that the morale was low among the nurses having to treat COVID in this COVID unit. And so they were like, well, as admin staff, they voted that someone from the group needed to go and help encourage them. And of course, the only Black person in the group who was an administrator was the one who was sent to go encourage the other nurses. So we're in these service industries where we are on the front line. Many of us are, doing the cleaning, the cooking, especially inside of the hospitals or many other places that we've seen this happen. So the issue of having to work from home, not having the essentials are a big problem. And then of course, those of us who are out of work, reduced work, or temporary work, where essentially you've already riding on the margins, you're already struggling to make your house, note, light bill and all that. Now you've had reduced work, or essentially have been cut out from work. That has become a big problem. And I've seen even where it's been stressful, where that realize that everybody's not broke and everybody's not poor. Everybody's not paycheck to paycheck. So you have a lot of people who've actually just quit work, and it increases the work stress on some of the individuals who are actually left to be able to have to work. Next slide. One back. Can we go back one? I think we may have skipped one. So who is most vulnerable when we're out of school, when school is out? So you have to look at, there is strength and safety that occurs inside the home, but as we just talked about, there are things that are lacking inside the home. But also with kids being out, you lack social development. All right. A lot of our, what to do right, what to do wrong. Yes, ma'am, no, ma'am, waiting your turn, all those things for your small kids. But also you have the social development and identity development that you have that occurs in your older kids. Also, we have an issue of adequate food. A lot of kids depend on school for 2 meals a day, for breakfast and for lunch. And so often in families where they're struggling, there's not adequate food, or the parents are busy having to work. The kid has to be at school at 7:30. The parent had to be at work at 6 a.m. Parent doesn't get home until 6 p.m. And so essentially you're having this long periods where the kid may not have adequate food, or there may not be adequate food inside of the home. We have to look out for having, I'm not sure what we're doing here. I'm still on this slide here. Making sure that we keep safe environments, be careful of chaotic homes, but also missing out on mentors. Most of us know that, most of us had, had teachers who we looked up to, who were the professionals, who said nice things, who said kind things. In order typically to have a job, you have to have a certain demeanor about yourself. And many of us are missing those mentors, be it, athletics or in football, or that lack of contact to be able to talk to individuals. But then also there's always the issue of race, socioeconomics, poverty, parental education, the ability to know what's important. And also some families sadly do not even see the importance of education. I know that I'm thinking of a family of one of my family members, where it's multiple people living inside the home, and the mother is a person who's not on top of things and who does not seem to care to be on top of things. And she has told her kids, well, just sign in online and just leave the computer on, and that's all you got to do for school in order to get through it. Well, the problem is that for that parent, they're not taking education seriously. So it's important to make sure that we do that. And it's also encouraging to make sure that we have the resources. Next slide. Next slide, I'm almost done here. So for small kids, there are different issues when it comes to development. Small kids, parents having to work, not being trained teachers. Adolescents, they're losing their social connections. Your identity development tends to be done between ages of 13 to 23. So whether you're the smart kid, you could be, smart kids hanging with smart kids. You could be the weird kid, realizing that's a group of folk who hang together. You could be the athletes, but so often we're told that we're smart, we're intelligent, things that we could do. And that social connection of that development of being the tail dog, the tail dog on the college fraternity, all of those becomes an issue. And then we're looking at the problem of school completion, because school is more difficult online, that lack of interaction, but also the future of your chosen field. And I tell all people in school, whether they're in pre-K all the way up to graduate school, make sure you stay in contact with the school if you're having any struggles. Next slide. So as we talked about, watch out for the excessive news coverage. I know that was a question about excessive social media. You have to be able to monitor that and talk to your child about that. We are facing information overload in that, normally I could tell people, if you're noticing that you're becoming too stressed, if you look at your local news for 30 minutes and the national news for 1 hour, generally you've heard 95% of everything you could hear that day between local and national news. If each of those are 1 to 2 hours, you've heard it all for that day. Much won't happen until the next day. And we have to remember to give folks space and time to relax. It's important to protect protect your dome, protect your head, in that you sometimes need to just veg out and chill and understand it's okay to not be okay about things. All right. So if things are a little stressful right now, just take you some time, walk outside, exercise. Next slide. So what can we do for our children? We can make sure that they need to stay safe. Social distance, wear your mask, wash your hands, all right? Adequate sleep, realizing that because school is a little funny right now, I know a lot of families who are stressed out, who are allowing the kids to stay up and not setting a good schedule. Make sure you have adequate sleep. Child needs to set a schedule. Make sure we get exercise. A lot of us are stuck at the computer all day, so the need to get outside and move, especially with the sunlight, is important. Adequate nutrition. I always tell families who struggle with finances, uncooked food is cheaper than pre-made food. So I will see a family go and say they don't have money and say they go and buy a thing of breaded chicken breast. I can tell you raw chickens cost a lot less than breaded chicken breast. A raw chicken, rice and beans, and make sure you add in a vegetable, go a lot further than what you find at McDonald's. And for some reason, we fall into this thought that is cheap food or inexpensive food at fast food, and it's not true. It's always cheaper to cook at home. Be careful of your news coverage and what the children are watching. Make sure they have a quiet place to work in order to get their studies done. Stay in contact with the school. And also make sure if we need counseling, therapy, or or even to see a psychiatrist for possible medication management, realizing that depression is setting in, because it's one thing to be stressed immediately, but with this third wave, the chronic stress is growing out, and chronic stress can lead to helplessness and also feelings of depression. So just because you're stressed during this time does not mean that you need to see me as a psychiatrist, but the fact is that you may need to see a mental health professional, and there's no need to suffer when someone can help you. And then the last thing is adaptation. We need to adapt to our current environment, in that change is something that is going to be a constant, and those who do the best will be those who adapt to that constant change. And next slide. And that's it. I appreciate your time. Thank you so much. And on to the question and answer.
Thank you so much, Dr. Higgins. Dr. Nabors-Stevens?
But I ask that Dr. Higgins, you can stay with us and we'll do the questions at the end. At this point, I would like to bring on the chairman of the board, so to speak, Mr. Carl Brooks. He is an integral part of the Black Health Trust family and has some words to share with you this week. Mr. Brooks.
Good afternoon, everyone. This program, I keep saying to myself that they can't get better and better, but this program is just providing so much information on the mental issues that we're dealing with. It's just powerful. On Thanksgiving, we had a virtual Zoom with our family, and it was the first time we've done that. We're the kind of family from Savannah, Georgia, and Philadelphia that we get together, that everybody's together, and we talk to each other and lie to each other, and we do that every Thanksgiving, every Christmas. That's what we do. And this year we decided that it was a safer thing to do a virtual meeting. And we asked each of the participants on that call to talk about, what are you grateful for? What do you really appreciate with all this craziness going on? And I listened to the young people talking about their love for each other, and the grandmother, my 96-year-old mother, and her sister that's 93. And we talked about all that. And I thought about my beautiful wife of 47 years, my son and my daughter, and my nieces and nephews. And then I thought about Black Health Trust. To have an opportunity to work with Black Health Trust at this point in time in our country is powerful, and it's a gift that keeps giving. And I've had the luxury of working with the Executive Leadership Council and being president and CEO of that. And those are the top brothers and sisters in Fortune 500 companies on the business side. And we used to say that we're the baddest brothers and sisters on the planet. This group of talented doctors that we're dealing with and other health professionals is the baddest group of brothers and sisters on the planet. This is a blessing. To have the opportunity to work with these brothers and sisters is truly a blessing. We're not sitting back on our butts and talking about somebody needs to help us. We're helping ourselves. And I thank Dr. Maxey and Doctors Barber for sharing this and leading this and giving us the kind of insights that we're benefiting from this. And if my grandkids looked at me and said, "Granddad, what did you do when all this was happening?" And I said, all I did was sit on my behind and complain, they'd be very, very disappointed. We've got a duty to do what we can to make sure that our community gets the best information possible. Most of it comes from our community, but we've also identified serious partners outside of our African American community that are also helping us to get the word across. So I'm just blessed in that regard, and I take advantage of it every day to know that we're getting the best possible information on all that we do. I've got one final request for all of you. Those that live in the state of Georgia, we need you to get out and vote. As quiet as it's kept, things aren't over yet. We got to get out there and vote so that we end up with a Senate that will be supportive of the incoming president, and we need your help on that. And the last thing I want you to do is to look at seriously committing to donating to the Black Health Trust. We've been doing a wonderful job since June of this year to now, and we're working on a shoestring. And the truth is, the first questions that we're going to have to respond to as we work with the various grant providers and corporations: what is your budget and what are you doing to help yourself? Just as within the Executive Leadership Council, we figured out how we can help ourselves and then invited CEOs and others to the table. We've got to do the same here. We've got to help ourselves. And we got to get you to donate. Get on blackhealthtrust.org, hit the donate button, and donate to this organization. This is a fabulous opportunity for us to help ourselves. We're not sitting crying about who ain't helping us. We're going to help ourselves. And we need the help of this elite group of talented doctors and professionals to lead the way. Thank you guys very, very much, and have a great upcoming holiday. Thank you.
Thank you, Mr. Brooks. And now, before I turn it back over to Dr. Clark, I just want to share my appreciation to Dr. Higgins for addressing the very specific needs of our children. We need capture the essence of what we need to remember as we all move through these very trying times. So as a pediatrician, as a parent, as a grandparent, I just want to thank you so much for your words today. So now let me turn it back over to Dr. Clark.
I do have a question in regards to the talk that Dr. Higgins just had.
Go ahead.
Someone asked, is racism a form of mental illness?
So the question of is racism a form of mental illness is a debate that has been going back and forth among Black psychiatrists with white psychiatrists for some period of time. I do know that the late Dr. Carl Bell is well written in that particular area. And my answer to that is, I believe so, but it's, the question is, how much of that is ingrained, but when you try to illness type of behavior, then you have to say, where does that illness come from? And so so we have to be very careful in how we address that. But I do believe so. And when I say careful, I'm referring to, we don't want to say, well, this group of people have an illness that impacts this group of people. So we don't want to start putting labels on a lot of things that are social. But when you see some of the manifestations of what that does to individuals and the impact on another group, it definitely needs to be addressed, needs to be a part of the psychiatric framework when we're looking at the impact of racism on individuals, but also realize that when, the racism actually impacts the individual who is spouting it as well. As you can see, in our current issue in America, where you have people who are willing to disallow votes, and those are votes that they want to disallow are with, mostly Black people, in the Black areas of the country. And, obviously this group can see that. But what that group doesn't understand is that what you're trying to say is that we want to eliminate democracy. But you don't understand that there will be other people among you who disagree with you. And then that would cause you to disallow your vote. Or as some argue against, obviously Black Lives Matter and the choking out of George Floyd, the public lynching, and then also, police violence. And just to think of how this works, a friend of mine was doing a Black Lives Matter march against police violence. And the lady said to him, well, all lives matter and blue lives matter too. And he was like, well, they won't matter until Black lives matter. And then she yelled back, well, police shoot white people too. And he was like, well, why don't you grab one of these signs and get on the other side of the fence and march with us? And what white people don't realize in the United States, some of them, not all, argue against this, that white people are more likely to die by the hands of police than Black people in the United States because they're by higher number, but they're more likely to die by the hands of police than anywhere in the world. They shooting y'all too. So the problem with racism is that you can't even see how these things will help and benefit you and your community, because what you framework it in is all within the issue of race, which actually is detrimental to you, which at that point becomes an illness. You're actually doing things that are actually hurting your own individual self because of the fact of the issue of race when you put in the context of those people. So yes, I do believe that it is a mental health issue and it's something that needs to be worked out, but there's a lot of different, a lot of weight with that, but a lot of different variables that have to come together.
I'm going to interrupt here. There's an important history to the efforts to codify racism or racist behavior as a mental illness. In point of fact, racism is a public health problem, as I described earlier, and we can discuss that more if we have time in Q&A. But out of respect for our next speakers, I want to move the program on to introduce Dr. C. Freeman, who is a practicing geriatric psychiatrist with diverse experience as a public consultant, elder abuse expert, educator, and healthcare administrator. Dr. Freeman is a graduate of Howard University, and she completed dual internal medicine and psychiatry residencies at the University of Virginia. She also obtained an MBA degree from Pepperdine University and began her practice in Los Angeles. She's been involved in academic medicine at the Charles R. Drew USC Family Medicine, Meharry Medical College, and the Charles R. Drew University of Medicine and Science. She became the first and only African-American president of the Los Angeles County Medical Association, and in 2019 received the National Medical Fellowships Distinguished Alumni Award. She was appointed by the president of the American Psychiatric Association to the Task Force on Psychiatric Beds and continues her involvement in organized medicine as a trustee for the California Medical Association and a member of the Investment and Oversight Committee for the American Psychiatric Association. Dr. Freeman, thank you for joining us.
Work that they have done in terms of presenting information that will create the fund of knowledge that we will need as we go through my slides up. And I am not seeing my slides yet. Okay, I can see one of the challenges that has occurred has been the loss of the formatting of the slides as relates to colors. And I'm just going to walk through them and use a different device. And I'll just walk through the first slide, which is the title slide, and I have no financial interest to disclose. I wanted to describe my practice in Los Angeles, where as a geriatric psychiatrist, I provide services in skilled nursing facilities in downtown Los Angeles or Long Beach. I do integrated behavioral health, which means I see patients in a primary care office. I also provide clinic work in South Central, and I do in-person evaluations as well as the rapid adaptation of telehealth, which came about as a result of COVID. Regarding certain fundamental concepts, I just want to talk about the fact that the elderly population is a very diverse population. And those elderly, like others who have more educational resources, tend to fare better. Many factors can increase one's risk for developing a mental illness, and some lifespan-related changes include some of those risk factors. And any new symptoms of mental illness are medical until proven otherwise. So the concept of things being in your head, no, it could actually be a result of a medical condition. And that's why it's good to have a physical evaluation if you do develop symptoms. The focus of this talk is going to be on the discussion of depression. And it's important to recall that depression and anxiety can coexist. Anxiety can be a symptom of depression, and depression and anxiety treatments can be similar. Depression and anxiety can occur at any age, and depression and anxiety are not a part of normal aging. I'm pleased that we are addressing the issue of mental health in the elderly population, given that 80% of the COVID-19 deaths have been among people 65 and older. We see the greatest disparities among African Americans. We also see these disparities among Hispanics of all age groups, which were higher for whites, yet and still the rates were lower than that of African Americans. COVID-19 has tripled the rate of depression in the United States, and people of color are more likely to report higher levels of related stress, whether it be getting the virus, attending to their basic needs, or actually accessing health care. When we look at those conditions that have been increased as a result of COVID-19, it includes anxiety, depression, suicidal ideation, substance use, abuse, and dependence, and intimate partner violence. There are some common socioeconomic factors that existed pre-COVID that contribute to people of color getting the illness. And that includes crowded housing circumstances, working in essential fields, limited access to health care and receiving poor quality of care, chronic health conditions such as diabetes, high blood pressure, asthma, and chronic stress, and the associated decrease in immunity by exposure to things such as violence and trauma, having fewer community resources, income disparities and inequalities, as well as institutionalized racism. Many of these elements the previous speakers have spoken about in their talk. Other pre-COVID risk factors that are specific for Blacks, people of color, is the distrust of government and healthcare institutions. There are still some lingering effects of Tuskegee studies, and in general, having people coming to your community telling you what to do is not necessarily well received. Health literacy is another risk factor in terms of being able to comprehend the doctor language that we use in trying to communicate about illness and health. Some pre-COVID common factors common risk factors for depression in the elderly include social isolation and loneliness, financial constraints, disability, and recurrent losses. So I'm going to talk about how COVID-19 has worsened each one. As was previously mentioned, schedules have been disrupted. Well, it also affects the elderly. From a perspective of activity centers have been closed, medical appointments are limited, religious activity does not occur or does not occur in person. Family visits are reduced and eliminated, and social and community service visits may occur, but only by phone. The value of these visits can also serve as a buffer if one happens to be in an elder abuse situation. And so the absence of those visits may actually lead to more violence in the home. And it's important to recognize the difference between social isolation and loneliness is that loneliness is a sense of suffering from becoming disconnected with others. And this can have negative effects on our health because it serves as a stressor, creates a response in our body that actually lowers our immunity. How does it worsen our financial constraints? Well, many of the elderly are on fixed income and they don't have the resources to pay for delivery services. They also may typically access food banks or food pantries or other places where free meals might be served. And they cannot participate in extra income activities if they're able to do so, whether that be taking care of the youth, serving and providing informal transportation to those in the neighborhood, or for family members, engaging in market or street vendor sales, or actually being teachers or mentors unless they have access to certain technology. How does it worsen disability? Well, improper nutrition can worsen chronic medical conditions such as diabetes and hypertension. Medications often go unfilled. If they go unfilled, they can't be taken. So if one has some controlled medical conditions, they all of a sudden become uncontrolled because one can't get their medication. They are already unable to access limited medical care or defer seeking medical care for fear of contracting COVID. And if they are able to get care, sometimes the need for care may be overlooked by or minimized by healthcare workers in deference for patients who actually have COVID. Inactivity leads to decreased mobility, increased substance use may lead to injury, and ultimately decline in the ability to function can be perceived as a loss. Although becoming older can be associated with loss, it can certainly be magnified the older one becomes. And associated with being older can be the medical conditions. There's also some associated functional decline. Social supports and associated stimulation has been reduced as a result of the restrictions related to COVID-19. Not to mention the deaths of friends, family, or other social relationships that have occurred, and increasing the recognition of one's own mortality has occurred in terms of potentially being exposed to the disease, not just contracting it, but dying from it. Why? Because you're in a very high risk group. And this can be compounded by the losses associated with getting older in general and may lead to suicidal ideation or even attempt. Now, all is not lost because there's one thing about the African American elderly, and that's resilience. And that's that thing that helps us get through the challenges that we encounter, and at least in the United States, African Americans have encountered several challenges, primarily related to institutionalized racism. It certainly includes civil rights, desegregation, busing, and police brutality. Many of these things continue, and as Dr. Higgins mentioned, is a part of an ongoing discussion related to its impact on mental health, and that's one of the factors that holds true as relates to COVID-19 and its impact on the elderly, particularly those who are Black, Indigenous, and people of color. Now, what about solutions? Well, first of all, one should, to the best degree, keep with a daily routine. In addition, you can connect with others regularly by phone or other telephonic means. I call them COVID calls. During this period, I've become more familiar with the telephone than I have in quite some time. And being able to reach out to anyone, elderly or otherwise, and just ask them how they're doing. It's amazing the kind of social exchanges you can have, and also learn from our elderly in terms of how they may have managed through stressors in the past. Exercise where you are. Someone mentioned earlier about the classes online or video. I tell my patients who may not have internet access that if they like to dance, just turn on the radio and dance around the house. And if someone sees you dancing and thinks something's wrong, then I think you just should invite them to dance with you. As well as elders should consider learning better technology. For those who have been resistant to using the internet or smartphones or video chats, I have seen my patients become super savvy at using these as a way for us to stay connected and to provide them care. What about what we can do for others? Well, I already mentioned doing COVID calls. Call and check in. Also investigate to see if there are any services that they might qualify for and help them connect to those services. Be sure that the elders are getting the correct information. There are a lot of myths around COVID and the vaccine, and it's important that correct information is given to the elders, and particularly by someone that they trust. Also, if you're in a position to support food banks and like programs, either with funding or hands-on help, whether it be in delivery or preparation, there are opportunities in your community that I'm sure would appreciate your help. Also ask if you can help skilled nursing facilities and senior centers if there's anything that you might do. Certainly we want to ascribe to the guidelines that are given by our public health officials, but there may be some things you can do without necessarily having to go out in public or to leave home. Donate blood. Donate blood. Again, I understand there may be some hesitancy within our community to give blood. However, at this time, there is a shortage, and if you are comfortable and in a position to donate blood, please consider doing so. And not the last thing, but one of the other things you can do is I talked about seniors in terms of their need to learn technology. Take the time and teach a senior or elder about technology and be patient. It's important that when you get older, not all cells fire at the same rate as they did when you were 2 or 4 years old, which is probably a good thing. But to remember that to be patient with an older person, because it may take them several steps. We have to remember that our elders today are from a generation that did not grow up with cell phones in their hands. So be kind and be helpful. A special population of concern has to do with unpaid caregivers for adults. And I bring this up because not only do we have to have concern about our elders in general, but we also have to be concerned about their caregivers. Giving care, and particularly if you're unpaid, to someone can be very, very challenging. And there may be opportunities now for someone, family members, other people to help in the caregiving. Not only because it may negatively impact the mental health of the caregiver, but it could also negatively impact the care of the one who's receiving from the caregiver. And that includes children who may be at home or in the home, as well as those elders who are receiving the care. And those are the main things that I think are of most concern and to keep in mind. And I'm open to any questions at this time.
Thank you very much, Dr. Freeman. Dr. Clark?
Thank you. I've been unmuted and I will rejoin. I have a question in my chat box asking Dr. Freeman to speak to the use of CBD and/or THC in seniors. And I want to recognize that I'm pretty sure Dr. Lisa Curvin, who is an expert in the use of those products, is also online. Dr. Freeman?
Yes. I am unaware of specific data that looks at the exact benefits of the use of CBD in seniors. I have specific concerns related to the use of CBD in aging brains, because in general, aging brains are sensitive to side effects more than any other condition of brain. And that doesn't specifically relate to my concerns related to CBD, but it relates to any substance that might alter one's sensorium or ability to think, or their impression of their life experience, whether in terms of possibly precipitating what we call a thought disturbance that could be characterized by seeing things or hearing things or thinking people are out to get them. So in my practice, I do not prescribe CBD, and I recommend refraining from the use of any substances that could potentially be mind altering unless there is no other choice. And examples such as no other choice might be chronic pain or other chronic medical conditions that cannot be managed otherwise. And this holds true whether you're older or younger. If you have a psychiatric illness that is being treated with psychiatric medications, ideally, you want to keep the picture as clean as possible. So the use of substances that may potentially alter one's experience, we recommend that you refrain from that. And I would defer to my CBD colleague to speak to any additional information or data that might be available. Am I muted?
No, you're fine. Dr. Clark is muted.
I see.
Thank you. We have 1 minute. Dr. Curvin, do you wish to make a comment at this point addressing that question? You'd have to unmute Dr. Curvin in order for her to speak. Okay, she may not have been expecting that. So
So
we'll,
Dr. Clark,
yes.
No, I am in Jamaica, so we actually do use most of the elderly that are already on CBDs, or even, or we actually mix. They're not, most of them are not just on plain CBDs, have been taking it on and off for years for multiple reasons, not just for depression, and they didn't start, no. I think we have to be very careful who we start, and that's actually individually started and individually adjusted according to their other medical issues, not just with depression and stress. So it's not something we do willy-nilly. It really depends what other things are going on, and it's not our first choice. We may use SSRIs, but we do use marijuana here in Jamaica as well. But we are very careful. We don't, and we actually know the dosing. And it's usually done with a physician and with also other counselors or psychiatric help. I don't know if that helps a little bit. I think people have the impression that you come to Jamaica and you just go ahead and use it. We don't. It's not like that when we prescribe it at all. We use a lot of it in the elderly with chronic health problems, a lot of cancer or end of life care, and they're also depressed. But we actually start the mixes low, and then we actually go up accordingly as needed and as tolerated. Is that helpful?
It's quite helpful. Thank you. In the interest of time, I'm going to move forward and we'll finish up with questions at the end. I have found, at least I thought I had just found the introduction for our next speaker, who I haven't had the pleasure to meet personally, but I'm very anxious to hear her presentation because what she discusses is the most critical issue that we have in terms of life and death and mental health, and that is suicide. Ms. Fonda Bryant is serving her second term on the State Board of the National Alliance on Mental Illness, or NAMI, as we all know it, and volunteers with the Cabarrus County.
Cabarrus County.
Thank you.
You're welcome.
Branch of that organization. She's also volunteering with the American Foundation for Suicide Prevention and the Mental Health Association of the Central Carolinas. She recently started her own foundation called Wellness Action Recovery, which is a nonprofit geared toward putting the work for mental wellness and recovery through positive action. She's been awarded the NAMI North Carolina Advocate of the Year Award for 2020. Congratulations. And the Mental Health Association of Central Carolina's Outstanding Advocacy Volunteer Award in 2009. And I could go on, but her time is already encroached upon, so I'm going to turn it over to her now. Ms. Bryan, thank you very much for joining us.
Well, thank you very much for having me. I really appreciate it. And the first thing I just want to share with y'all is a little bit. I've been listening to all of y'all, and I also am a peer support, a North Carolina certified peer support. And I think peer support is very, very important. We don't get enough credit. And I think in moving forward, we need to all work together. And lived experience in my, with what I've been doing has been invaluable, because I am a 25-year suicide survivor. 25 years ago on February 14, 1995, I was dealing with depression, had no idea I had it, because in our culture it's pray about it, don't claim it, give it to God. It's a sign of weakness, and that mentality is killing us. It's still killing us. And we have to do a better job. Calling people crazy and nuts and psycho and cray-cray does not help at all. As a matter of fact, somebody alluded to that fact that when they ask doctors and things, you know, that they need to see somebody, the first thing they say is, oh, I'm not crazy. And I have that all the time when I'm trying to help people of color. And they'll say, Fonda, will you please help my son? And the first thing their son will tell me is, Miss Fonda, I'm not crazy. So words hurt, but words can help. So for me, my Aunt Kelly, 25 years ago, I was working as a pharmacist tech. My son was 12 years old and depression hit. And to be quite honest, it ran in my family, but we didn't discuss it. We'll discuss high blood pressure. We'll discuss diabetes, but we won't discuss mental health, and that needs to change. My hope before I leave this earth is to make mental health, to normalize mental health and normalize the conversation. So with my depression, at my hospital, they sent me home and they sent me to go get help, but I still was terrified to open up and share because of my family. Again, that stigma was so thick, but I reached out to a hero who will always be a hero. And it's because of her that I'm here. My Aunt Kelly, her nickname is Spanky. My nickname is Tweety. We grew up 3 years apart, and I reached out to her and told her she could have my shoes. And I hear this a lot in the Black culture. Oh, they just want attention. They're not going to really do anything. Yes, I was. And my aunt could have said that. But instead of that, she called me back, asked me, was I going to kill myself? And I told her yes. And she didn't hesitate to go into action like a superhero. She had me involuntarily committed. A police officer came to my door later that day and against my will took me to a mental health facility. Don't smoke, drink. Never done drugs. I was so mad at her. My mom was mad at her and my grandmother, but she didn't care. She saved my life. And that's how we have to be. We have to be about action. When it comes to someone who is in crisis or suicidal, you can't worry about, well, they're going to be mad at me. My family's going to be mad at me. You have to do what it takes to save their life. And that's what my Aunt Kelly did. So going through what I went through, people ask me this all the time because I do a lot of interviews here in Charlotte, and they say, well, Fonda, you could have gone the other way when you came out of the hospital. Why did you want to turn around and help people? I said, because it's a lot of Fonda Bryants. It's a lot of Fonda Bryants from all backgrounds, all races, all ages. And so I have been an advocate for over 20 something years, but I became a powerful advocate when I joined NAMI because I became educated and I learned more about my mental health condition. And so today, besides being with NAMI and American Foundation and Mental Health America, I also am a QPR, Question, Persuade, Refer, suicide prevention instructor, and I'm also a certified mental health first aid instructor for youth. When the World, not the World Trade Center, but when the governor of North Carolina issued the stay-at-home orders, the QPR Institute had told us we could start training at home, and I wasn't sure if I was going to do that. But I decided, hey, it helps me. Giving to myself helps me with my mental health condition. So I started training on March 26th of this year. I took a break in June because I was exhausted, and I trained from March to the end of May, 600 people from 23 states and 5 countries in how to save a life. But I didn't stop there. As I said, I took a break in July, and then I started back training again in June, and started back training in July. And to date, I've trained over 800 people from 24 states and 5 countries. And everyone should take QPR suicide prevention training. I don't care if you're a professional in this field. Everybody needs to learn how to save someone's life in a positive and upbeat manner. And to show you how powerful this training is, I want y'all to see a video that WSOC TV did here in Charlotte on me, where a young man 2,000 miles away from me in Utah was struggling with a mental health condition and threatening to kill himself. But what he said in a tweet did not say any of that. So if you could please show that video, I'd appreciate it. Are they going to be able to? Okay, here we go.
Calls, Fonda Bryant helped Chaz Ayu, who was contemplating taking his own life.
Today in Myrtle Beach, they got to finally meet in person. Donovan Harris from the ABC affiliate there, he was there.
I can't believe how nervous I am.
Fonda Bryant waits in the hall of this Myrtle Beach hotel.
Not nervous, just full of anxiety.
To finally meet a person who she's never met in person before.
I can't believe this.
But whose life she saved from more than 2,000 miles away. That embrace, more than 6 months in the making.
I just can't believe I'm seeing y'all.
Moment of joy now, but it's a story that begins with sorrow.
Pass breakup incomplete. That is Chaz Ayu.
Chaz Ayu is a linebacker at Brigham Young University. A star on the field. He's 6 feet, 200 pounds, but the weight of the pandemic and racial tensions coming to a head after George Floyd's death made even a strong athlete feel weak.
In my mind, I just felt like there was no real escape from what was going on.
And that's where Fonda comes in. She got concerned when she saw this tweet from Chaz back in June, which read, "Disappointed that fans turned this into a competition of what lives are more valuable, or made it political. We need you to understand our pain, not fight it."
I just knew something was wrong.
So Fonda, trained in suicide prevention, reached out to Chaz.
And then he was like, well, did the coach put you up to it? And I said, no. I said, I knew you were. in trouble.
After a lot of pushing for weeks, Chaz admitted he was suicidal, staying silent about his battle with mental health.
And before this, this whole learning experience that I've had, I saw it as a weakness in my game.
Now Chaz and Fonda text every day, sitting together for the first time Saturday.
It's kind of like meeting your super.
Fonda, can you summarize the video?
Yeah, I can go ahead and summarize it. At the like I said, Chaz had posted a video. I mean, not a video. I'm sorry. What happened was that Chaz attends Brigham Young University, probably one of the whitest schools and the whitest state in the country. And a friend of mine had been a coach there, Coach AJ Stewart, and he had left, but I still followed BYU. So they had a social justice video up with a lot of the BYU players, and they were talking about Be the Change. And Chaz was in that video. And when Chaz when he was talking, I could kind of see something was wrong. But when he posted what he did, that tweet, I knew something was wrong. That tingling, that almost spider sense tingling, that gut feeling, I knew something was wrong. So he was a total stranger, but I reached out to him in a DM on Twitter, and I asked him, I said, hey, young man, are you okay? And he took a while to respond back, and he responded back and he said, yes, ma'am, I'm okay, thank you. But I didn't believe him. And that's part of the QPR suicide prevention training. If you feel like that someone is suicidal or they're in crisis, you got to be persistent with them. And even though I didn't know him, I asked him straight out, because by just that tweet, I knew something was terribly wrong. So I asked him, was he suicidal? And he didn't respond for a couple of weeks. And then he came back and he started asking me questions like, did my parents put you up to this? And I said, no. And then he asked me, did the coaches put you up to it? And I told him, no. I said, I knew you were in trouble. And I had given him my information. I had told him he could reach out to me. I told him who I was. And so he said, well, I could really use your help because I've been struggling myself. So he and I started texting offline. And he told me 2 weeks, he said, I still can't believe, Ms. Fonda, that you knew I was in trouble. He said, because 2 weeks before you reached out to me, I was planning my suicide. So I credit that to divine intervention, being a suicide advocate myself, but also knowing the warning signs through my training. And so that's why I have been urging everyone to take this QPR training. It is an hour and a half long, and it teaches you how to recognize someone in crisis or suicidal, how to talk and listen to them. And this is very important because a lot of this goes on daily, and not be judgmental. You cannot be judgmental when you're trying to help us. I know people think, you know, you can look at somebody and say, oh my God, you got your degree, you got a great job, you're a student athlete, you're beautiful, whatever the case may be. That has nothing to do with anything. And if you come across saying, well, I can't believe that you could be depressed and you got this, 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 and this, we're going to shut down and we're never going to talk to you again. So you cannot be judgmental, and in a positive, upbeat, and providing hope, you can save someone's life. And that's how I was able to save Chaz. He told people, and he had been going to therapy, but he said, because of what I said to him, because I know what it feels like to not want to get up out of the bed. I work out 4 times a week, and that's one thing I've been happy to see y'all talking about exercise. I work out 4 times a week. And if you saw me, you say, yes, you're very athletic. But it's days I go in the gym and people say, hey, Fonda, how are you doing today? But I'm not fine. I might look fine, but they don't know that 20 minutes earlier, I was sitting out there in the car crying, trying to will myself to get out of the car and come inside. I didn't feel like taking a shower, brushing my teeth, or combing my hair, and my arms feel like they weigh 150 pounds apiece. And that's also in the training. I urge people to remember, treat people with empathy and compassion and kindness, because a smile can hide a lot of pain. And that's what and that's why, again, I really push this training. I really believe in it, and I know it has saved lives. So one of the reasons why I want to get on here is to urge everyone who's listening to this. Number one, you're not alone. And if you're going through something, don't be ashamed to get help. But number two, I am training my last QPR suicide prevention class this coming Saturday, December 19th, from 1:30 to 3 o'clock Eastern Standard Time sharp. If you take the training, you get a 3-year certificate that says that you are a certified gatekeeper, and you also get a QPR booklet. And this is what my saying is with this training. What is an hour and a half out of your day if the time is spent learning how to save someone's life? My Aunt Kelly saved my life 25 years ago, and it has been a struggle. Depression is no joke. It will beat you down and make you feel like crap. But I fight every day because I know what it feels like, and I want to help people to know that whatever we're going through, there's help, there's hope, and we can recover and we can get better. So I hope everybody who's on here will be willing to take the training. I've trained people from California, Utah, New York, you name it. I've trained it. I've trained psychiatrists, therapists, sports psychologists, student athletes, teachers, you name it. I've trained it, and I've been very proud. And I also can train youth, because youth need to take this training. When you look at the suicide rates, I have trained youth, and I will say this. There was a young man who took my training back during the summer that was in a high school band in one of the schools I speak at, and he took the training. And the only difference between the adult QPR training and the youth QPR training is we urge youth to go tell somebody. I don't care that your friend says, if you go tell them, I'll be mad at you, you go tell any. And this young man, you could tell it was weighing on him before he took the training. He took the training, became certified, and as soon as he got finished with the training, reached out to his school and saved one of his bandmates' lives. That's how great this training is. And in Charlotte, North Carolina, where I live, schools are now starting to train students in QPR suicide prevention training. So I train free on Saturdays. I do paid training. Like tomorrow, I'm very proud to say, I will be training 35 attorneys from the Mecklenburg County Bar here in Charlotte. And the class filled up so fast that I will be training more attorneys in January, but I'm hoping it's going to keep going. So again, if you want to take the training, please reach out to me and I will give you the information for the training. But everyone should take this training, and I appreciate y'all having me on today.
Thank you so much. That felt very, very personal to me. And I definitely am going to take your training, and maybe even the Black Health Trust can sign up for a training for people who are on our lines too. Thank you so much. Dr.
Quite well.
Dr. Clark, do you have any initial questions or anything in the chat box?
I don't know about the chat box, but I wanted to go back to address some of the questions that were spoken to before, particularly around the issue of people's fear of being called or labeled crazy. It's important to understand that crazy is not a medical term. It's not a psychological term. It's an insult. It's an insult that we use, unfortunately, too freely, and it doesn't refer to the social conditions that cause stress-related anxiety or to the medical condition that causes depression. And to keep in mind that the primary work that psychiatrists and psychologists do, that do clinical work with direct patient care, is we address depression and anxiety. Those are the major disorders that we have. Schizophrenia is a relatively rare disorder. And most of the psychosis that we see, which is misunderstood as being schizophrenia, is substance-induced psychosis. So it's important for people to understand that crazy is not a medical term, and that's really not what psychologists and psychiatrists primarily do. The other thing is on the issue of racism. The issue is with racism is that it's a behavior. And without intending to, one can be complicit in that behavior, including people who are Black can be complicit in that behavior. It's pervasive, it's institutionalized, it requires collusion, and most recently it's been condoned and stoked at the highest level, highest political level in our nation. Keep in mind that it's a shared delusional belief. You could call it a folie en masse. And as I said before, it's a public health disorder. So to individualize it is particularly difficult. Alvin Toussaint years ago tried to get this entered into the Diagnostic and Statistical Manual of the American Psychiatric Association and did very good research to codify it, but it didn't make it through. And the behavior was listed in the 4th edition of the Diagnostic and Statistical Manual, which is basically the dictionary that we use to identify psychiatric disorders. It was mentioned in the appendix along with other culturally related syndromes. So we're working on it, but it hasn't gotten there yet. Are there questions in the chat box?
There are no questions in the chat box. Wait, how do we help patients that are challenged by alcohol yet have prescriptions?
Somebody want to take that? Okay.
I can make a comment, Michelle. You know, there is very successful substance abuse and alcohol use treatment available. And there are specialists in this area and programs that can address that. So often people need to, you know, find out about those resources in their community. They can be referred by mental health clinicians, but they can also be referred by primary care clinicians. And what I can tell you is that there are now some organizations that do treatment for addiction and substance abuse via telehealth as well. In fact, at UCSF, we work with a group that has 24/7 treatment available for people. So there are now more resources out there.
Great, thank you. And several people would like Mrs. Bryant's contact information as well as the suicide prevention training. I do have a question. What strategies have you found effective in addressing suicide in
African American
teens, particularly considering the issue of stigma?
Are they asking me?
Yes.
Was that for me? Well, one of the things I do a lot of speaking in the high schools, and that's what I said. I normalize mental health and suicide prevention because number one, I share my story. And I'm very open and honest with it. And I don't pull, any punches, but I also provide hope. That's one of the biggest things that a lot of people have lost that. They lost it before the pandemic, and now they're losing hope now because of what's going on. So with me, I always provide hope and let them know that I'm standing there because of my Aunt Kelly, but I have to fight every single day. And I let them know that if they're going through something, to not be ashamed. And if they can't talk to someone, which I have a lot of students, it's always funny to me when I speak to students and I'll get up there and I'll share my story and we'll talk about different things, and you can hear a pin drop after I ask people, do they have any questions? But the minute that they say, okay, we're finished with this discussion, I get slammed with students. Right now, I can't even tell you how many high school students are in my phone right now that I check on every single day. And I think one of the biggest things is that, and this is what I tell parents and when I'm training, is to not be judgmental. I have a son that's 37 years old, and that's my pride and joy. And he saw me when I was handcuffed and taken to a mental health facility. He has gone on to do very well. He played football and graduated from Wake Forest University. He is a on-air talent and a producer. He's an on-air talent and a producer for the ACC Digital Network, and he works for Fox Sports. And I wondered how that was going to affect my son, seeing that. And he came to me about 4 years ago and told me the whole time he was in college playing football, he was dealing with anxiety. But I remember telling him when he was younger, because I was a single mom and I worked 2 jobs, I would tell him, you don't have anything to worry about. Just go to school, make good grades, and play football. That's all you got to worry about. And that's dismissing and discounting their feelings. So one of the things that I always tell parents is to listen and talk to them and not be judgmental. And I know it's hard because I remember myself when Wesley was younger. But if you don't listen to these children and hear what they're saying, they're going to go and find somebody who's going to listen to them. And it might not be good advice at all, especially when some of them have told me they've gone to their peers who are 15, 16, and 17 and gotten bad advice. So one of the things, even with African Americans particularly, parents need to do a better job of listening and hearing, but they also need to do a better job with letting their children come to them and talk to them about mental health. Because when I talk to Black parents, sometimes I have to pray because, again, it's that stigma. It's nothing wrong with my child. They're not crazy. But I always kind of spin it around and I'll ask them, I said, listen, if your child had diabetes or heart problems, would you hesitate to go get your child some help? And they'll say, oh, no, I wouldn't do. I'd take them right away. I said, guys, the brain is an organ. It can get sick, but it can get better. And sometimes when you flip it like that, parents are more apt to listen and realize that mental health is physical health. So again, with African Americans, I think the biggest thing is, like I said earlier, we got to do a better job with that stigma, get rid of those words that people think that don't hurt us, but they do, and listen and talk to our children and not be judgmental.
Dr. Clark, I have a question for both Dr. Higgins and for Ms. Bryant. Is there a difference in a teenager, say 15 or 16, telling their parent that they're going to kill themselves, that they're going to hurt themselves, versus an adult? Is that a different issue, a different approach?
My quick answer would be the need for an emergency approach to make sure that person gets the correct help and right help they need is no. There is no difference. A 15 to 16-year-old who says they want to kill themselves versus an adult who wants to kill themselves versus an elderly person versus a 5 or 6-year-old. All of those are considered to be emergency situations that need to be addressed, and I would do so immediately.
And I agree. I'm sorry.
Go ahead.
I would say in the training, that's one of the things that we teach. You have to take all signs seriously, and no matter what age a person is, if someone says they're going to hurt themselves, you cannot wait around to see if they're really going to do it. You have to act right away.
Dr. Higgins, are there a couple of questions that you would recommend to parents that they routinely ask their children, if not every day, every couple of days, to facilitate the communication and identification of impending issues?
Well, one thing it's always important to do is, make sure we pay attention to our kids. A lot of things are going on right now. A lot of distractions are going on. So we have to make sure we pay attention to our kids. And when it comes to talking with your kids, it's rare that you have a family who eats together where people don't talk. It's part of the communication that we do when there's food, there's conversation. So normally if I see someone not speaking, then that becomes an issue. But when it comes to, discussing issues regarding suicidal thoughts, it's important to make sure that you pay attention. If you see any change in behavior, if you start to see that the kid is starting to become more withdrawn, not talking to family, not taking care of themselves, maybe arguing, more argumentative, more aggressive, not taking care of their basic hygiene. Normally there's a set of things that go along with it. And when you're hearing a person say it, then I tell people it's like, you don't know what the person will do. So you don't want to minimize it at any age, even with an adolescent or anything like that. So it's important to make sure you get them into your professional at any time. But we have to make sure that we're in communication, look for those changes. Now, would I say if we're having a good time eating lunch, now I wouldn't just break out with, hey, are you thinking about killing yourself? Obviously, but normally there's a set of events that's going along with it. Always stay in communication. Always ask your child, is everything all right? Everything going okay with school? Everything going okay at home? How are we doing emotionally and mentally together? And kids want to hear from their parents more so than anybody else. No matter how much social media there is, no matter how many friends they have, they want to talk to their parents, and you want to make sure you keep that line of communication open.
Well, thank you so much.
We have a really good question for Dr. Higgins, if I can. Some children from families with adequate SES are placed in education pods, which seem to be a helpful surrogate for school while maintaining COVID health and safety practices. How can we bring these educational pods to lower SES children?
I'm not sure exactly what we're referring to as an educational pod, but
so I can explain that a little bit, because actually my daughter is in a pod. It's a small pod consisting of 6 children, and we've all made agreements to practice safety, and they're wearing masks, they're socially distanced, and we've all have our own little set of rules that abide by all the safety measures while maintaining healthy social agreements within the children.
So they're saying that the pod has worked well for certain families, and how can we get that to lower SES families?
That's what the question was. Yes.
That's what the question is. Well, I would say there's safety there is a bit of safety when it comes to finances, and then there could be a lack of safety when you don't have them. So what I would say is that we have to pay close attention to what's going on inside of our schools right now. I know for myself, being a child and adolescent psychiatrist, when it comes to special type programming that we have in school, realizing that that's going to be done through special education. Special education is not bad. Too often I hear in Black communities, I don't want my kid in special ed. Well, all additional services for schools, be it for kids who are not doing well or those who are doing very well, all of that goes through the special education funds. So whether it's gifted and talented, advanced class placement, or receiving help from special education so far as I'm struggling, all of that comes through the same fund of money. And the problem that I've seen is that I have not been receiving paperwork this year. So a lot of kids who are on the margins are being left out of school. Schools are not paying attention to this group of kids. So it's important to make sure that they're receiving the help that they can. Now, when it comes to pods and the ability to finance that, so far as having an educational teacher outside of the classroom, that can be very difficult for school districts to figure out at this point. But at the same time, I do know kids who are, say in private school and things of that sort, who are receiving scholarships and things of that sort for that help. But that can be very difficult to set up outside of the school system for a person who lacks the financial resources.
Well, thank you so much. We're coming to a time when we close our program, but I want to first of all, I want to thank our psychiatrists and our other consultants for joining us for this great information. Dr. Walks, Dr. Higgins, Dr. Tish, and I want to make fun of your first name. Is it Make America Great Again? And also Dr. Clark for putting together this program, Dr. C. Freeman, and we certainly appreciate and honor each of you. I wanted to make a couple of announcements, Dr. Stevens, if it's okay. Our website is blackhealthtrust.org, and you'll find on there archives of all of the speakers that we've had in the past and currently, and there's information on that site, and our site is in the process of being upgraded over the next few days as well, but it's still a good site to go to. There are a number of affiliations that we have that will help our financial survival. One, we have a relationship with a Legal Shield that if any of you need legal advice, you can find the link on our site to sign up for Legal Shield, and it's good for consultation. I used it this week with a car dealer to help out with the situation. More importantly, we have created a relationship with a company called Biometrics, Second Opinion Expert. And many of the physicians that you heard today and have heard in the past have formed a network of expert physicians to provide second opinions if you request it. And for the first 60 to 90 days, it's going to be free of any type of charge except for your insurance. And you can find that link also on the blackhealthtrust.org. But the direct link is biometrics.secondopinionexpert.com. And it's something where you can have physicians who are, most of whom are minorities, not all, but who are clinically and culturally competent to deal with many of the issues that we have of trust. We're also forming other relationships. I went to the store to get some medication for myself, and I hit something called the donut hole, which means that I had to pay cash over $700 for something that my insurance won't pay for the month of December. So we formed a relationship with a company that will provide medications at a wholesale price for a small cash price. We've also formed a relationship with another company to help get you healthy, make sure your vitamin D levels and things are correct and your immune system is up. We'll be announcing these companies in the next week. We're trying to find every way we can to provide services, competent services, credible services to our community. We even are working with a company called, what's the name of the company with Dr. Stein, Dr.
Self-Pay Medical.
Self-Pay Medical, where you can get, for example, an MRI scan that might normally cost you $3,000. You can get it for $300. So we're trying to bring these services to our community and see if they can help. And we thank and honor our speakers for giving of their time with us today. Our program next week, we're going to concentrate on getting a report from the National Medical Association and other experts on vaccines. We're going to ask Dr. Wilbert Jordan to be one of those speakers. I'm going to rain on Dr. Walks to be a speaker and a number of others to talk to our group about the status of the vaccines. And we certainly appreciate you. Our medical advisory is going to meet on Wednesday, and we're going to have continued interaction on the safety and all the issues around vaccines. And we appreciate you joining us week after week. And we hope you look at us on Facebook. We hope that you give those thumbs up and like us. And we also need your contact information if you didn't get a direct information invitation, but we're forwarded something from somebody's email. We're trying to grow our list. We have between 7,000 and 10,000 listeners. We want to grow that to many more. Dr. Barbara Stevens, did I miss anything?
Dr. Mackey, I have a question.
Yes.
Several people are asking about the training, and will that be on the website?
We will put it on the website.
Okay.
Dr. Bryant, are you still on?
Yes, I'm still here. It's just Fonda. I'm sorry. Yeah, it is the web, and they can always. I'm sorry. Hold on. And they can always reach out to me on Facebook if they want to know more. But if you put my email up there, they can reach out to me. But anybody is welcome to take the free training on Saturday. They have to take the full hour-and-a-half long training, and please be on time because the training is so important. But once you get finished with the training, you will get a certificate. I always email the certificates out, and you will get a QPR booklet to keep. And it really is a great training. It's a great training.
Email quickly. Give your email.
It's Fonda, FONDA, NC _ 40 at yahoo.com.
Dr. Barbara Stevens, Neighbor Stevens, I'm sorry.
No problem. I think I know that my cup overflows today after the wealth of information and wisdom that has been exchanged. And I certainly hope that everyone who hears this broadcast is able to take something to heart and take it away with them. And lastly, and most importantly, remember your 3 W's this week. And we look forward to seeing you next Sunday.
And I'd like to give special kudos to Dr. Michelle Clark, whom I've known for at least a couple of years, and appreciate you putting together this wonderful panel today, Dr. Clark. You have a final word?
The final word is this is just scratching the surface. There's so much more information that needs to be provided to the community. So I'm going to suggest that we routinely have mental health input to answer the many questions that didn't get addressed today. Thank you so much. And especially to my volunteer speakers, because this is a big piece of personal time impacting their mental health. So I want to be sure that they know how much we appreciate them and encourage them to join us again. Thank you. Thank your families for sparing you. And hopefully you'll tune in for some of the other very helpful information.
And
Thank you.
I want to give one further shout out that there's an individual on the phone who was the first female and the first Black president of the Los Angeles Medical Association, Dr. C. Friedman, and we certainly appreciate you being online with us. I'd like to call on Ms. Brenda Lee Ager to take us out. Will you unmute Ms. Ager, please?
What a wonderful program we've had today. I'm so elated and thankful to all of our guest doctors, and it's just amazing that we can actually get information that we've needed all of our lives. So I bless everyone on the program, and I just want to say, we shall overcome. We shall overcome someday. Oh, deep in the heart, I do believe that we shall overcome someday. See you next week. God bless us all.
Thank you, everybody. Have a good day.
Bye-bye.